I had a patient come in, initially very vague symptoms, came in with nausea, vomiting, headache.
I was nauseated, lightheaded, disoriented, and everything. I really didn't know where I was at.
He was actually here for his COVID vaccine. The COVID clinic actually brought the patient to me. I took care of him in the room. We checked for COVID. He was negative. Cardiac workup showed that there was no cardiac involvement. Everything came back normal on this patient. We treated him for dehydration. He said he was feeling much better, gave him IV fluids, and he was sent home. Several days later, the patient ends up showing up back into the triage area where I'm working in triage. I recognize the patient. Wife went ahead and explained to me that they were seen at 2 local area hospitals. Nobody could figure out what's going on.
I was laid back, my eyes was dazzling in my eyes and everything. I couldn't hardly breathe, could hardly talk. I recollect he was clowning with me. My wife said he was clowning with me. We and him was joking around with each other. He was very professional though. Yeah, he was very professional. He got me back there back to the emergency department quick. Yeah, he asked me questions about it, and I told him how I was feeling. And as soon as I leave out the house and stay outside for a while and everything, and ride around in the car, I'm all right. But as soon as I come back in the house, and if I lay down and wake up, I'm feeling sick.
I was thinking, what's going on? There has to be something going on in the home. And at that point, I looked at the spouse and said, how are you feeling? So I had to reach out. I had to ask further questions because something wasn't adding up. The wife began to explain to me that she was starting to have symptoms. She was having a headache. She was starting to feel a little nauseous. I asked the wife, if there was any recent work done in the house. The wife had told me that no, they live in an apartment complex, but they do believe that the landlord had a new furnace put in. And light bulbs went off at that moment. At that moment, I told her I did not want her going back into the home, that I wanted her to go ahead and call the gas company to have somebody come out free of charge. They would go ahead and check to see if there would be carbon monoxide present. We took the patient back to be treated, and about an hour later received a phone call from Consumers Energy stating that whoever the nurse was that had them come out had possibly saved their lives along with some of the residents in the apartment complex.
Wow. Now, how was I feeling? Oh, I was feeling lost in a sense, really. That, hey, I could have lost myself, my wife, in the house. If I had kept on breathing it, we could have wound up waking up dead one morning, VA was very instrumental in saving me. Yeah. Yeah. But I could have died. I could have went back in the house and died up in there.
The following day, the patient came up, and I was training. I had 2 students with me from a local university, University of Detroit Mercy, and the wife wheeled the patient in. And they sat down and they said, Rick. I'm like, yes. They said, thank you so very much. It was carbon monoxide. And she gave me the biggest hug and gave me a kiss on my cheek. And they gave me a hug and they said, you saved our lives.
I said, thank you. Hey, I said, you were right on. I said, you was the only one that could tell me anything about what was going on. Richard Hall, he figured it out.
It was impressionable on the students I had. They were like, oh my goodness. To come back to know that I had that effect on somebody it's the greatest feeling in the world. It really is. It's wonderful. That's why I do what I do. That's why us nurses do what we do. My dad's a veteran. I'm a Gulf War veteran. I can think of nothing greater than not only to give back to my brethren, but again, to care for the community in which we reside.